Hello and thank you for joining us. Welcome to News Across Nigeria. I'm Olumide Macaulay. On today's program, the Save 1 Million Lives initiative meant to reduce child and maternal mortality. Illegal migration retreat opens in Kano to check illegal migration. And the All Progressives Congress meeting in the Southwest Zone. Thank you for joining us, where we show and tell you what's happening across the Nigerian Federation. One of the strategies to reduce maternal and child mortality and other related deaths in Nigeria is for the federal government to partner with states to extend the national insurance coverage to all Nigerians. Now, this is the view of the Kaduna State Governor, Malam Nasir El-Rufai, who says that poverty should not be an obstacle to adequate health care for any citizen. He was speaking in Kaduna during the Northwest zonal launch of Save 1 Million Lives program, where the Minister of Health listed the targets of the scheme to include maternal, newborn, and child health.
Maternal mortality in Nigeria remains worrisome, with the country accounting for 14% of the global figures. This is in spite of the fact that the prevalence rate is down from over 1,350 in 1990 to 840 in 2015 per 100,000 live births. Health experts say this situation is unacceptable, and the authorities have to look for more ways to make progress. The Minister of Health, Professor Isaac Adewale, is part of the consultative meeting in Kaduna, where he explains that the federal government is determined to tackle the problem.
With a maternal mortality of 576 per 100,000, which actually are figures you find in war-torn countries like Somalia, Afghanistan, and Sierra Leone. Infant mortality is extremely high, 69 per 1,000 live births, and child mortality of 128 per 1,000 live births. The SOML program of maternal and child death that can change health outcomes in this country. And this will then bring us back in keeping with global standards.
The host governor, Nasir El-Rufai, believes one of the ways to deal with the situation is to ensure extensive health insurance cover.
Let's we find a way to ensure all our people, to ensure that every person that is ill will not fail to go to a health facility because of poverty. We are not where we should be. I therefore call on the federal government to support the states to mainstream the national health insurance scheme such that every Nigerian, no matter how poor, no matter how vulnerable, will have access to health care.
According to 2014 reports by the WHO, every day about 800 women die globally from causes that could have been prevented during pregnancy. Higher risks of complications and death as a result of pregnancy are faced by adolescents when compared to older women. It's feared that girls under 15 years of age face a probability of eventual death from maternal causes, with 1 in 160 girls dying in developing countries.
Meanwhile, in the Northeast region, former President of Nigeria, Chief Olusegun Obasanjo, says President Muhammadu Buhari has shown understanding, particularly in the peculiar situation in the Northeast. Chief Obasanjo made the remark during a visit to the Adamawa State Government House, Yola, where he met with security chiefs and state officials. The former president commended Governor Jibrilla for not allowing the states to be subdued by the security situation in the region.
I can claim to be a citizen of Adamawa State, having lived here in Yola in the special security confinement for upward of 3 years. And the place where you live for 3 years, you can definitely claim to be a home. As you have rightly said, President Buhari has shown understanding, particularly of the special situation of the North. And he and I have talked about this. We have, in fact, got people in the international arena who have taken the issue of the North-East as a special issue.
Chief Olusegun Obasanjo, Nigeria's former president, still on the issue of security, but this time concerning the borders of the country. Efficiency at the nation's borders needs a more comprehensive approach to ensure that border security is done to prevent illegal migration. Those are the words of the Kano State Governor, Abdullahi Ganduje, at the opening ceremony of the 2016 Migration Retreat organized by the Nigerian Immigration Service. He says that effective and efficient border management requires dedication to achieve results.
The 2016 Management Retreat of the Nigerian Immigration Service seeks to reposition the agency for a more efficient border management system. Poor border control has remained a headache for various state authorities and has been on the front burner of discuss for many years. The state governor, Abdullahi Ganduje, is concerned that the contradictory migration policies remain a threat to border security for Nigeria and its African neighbors.
Exercising this sovereign responsibility, most countries have pursued a private unilateral approach to migration, with a general tendency to develop ad hoc strategies on migration issues to respond to domestic needs and interests.
The expectations are high that this retreat will come up with workable solutions for a border management system that can checkmate illegal migration.
I will expect the retreat, among other things, address challenges of passport and visa regimes, both within and outside Nigeria, as well as develop strategies for effective border security and management in the context of its complexity and dwindling resources.
The head of Nigeria's Immigration Service believes the only way to maintain border safety is to provide adequate manpower and modern security equipment in line with the international best practices.
We need equipment to do this. We can't do it alone. However patriotic and hardworking we are, we cannot afford to patrol the borders with our foot. I'm glad to say this year government is committed. We have seen the sign in this administration to support border management. And if it will continue, it will be a sign that even the international community will assist us. So that's a sign that things will look better.
In the interim, the controller is proposing a better welfare package and constant training of officers to enhance their performance.
From there to the southwest and to the weather and the environment, there must be an attitudinal change amongst residents of Ogun State to reduce the impact of flash floods expected to affect about 22 communities in 8 of its local government areas. And this is coming from the Southwest Coordinator of the National Emergency Management Agency, Mr. Yakubu Suleiman. He made the appeal while leading an advocacy visit to communities to enlighten them on the need for good environmental hygiene as an antidote to perennial flooding.
The cause of this incident is a big attitude of our people towards environmental laws. Dumping of refuse on drainages is a major factor. You can see the drainage on the background. You can see I blocked it already. Should there be a heavy downpour, the water must find its level. So our people have been, we have been telling them that they should please avoid dumping of refuse on drainages. It's in drainages. They should stop building on floodplains. They should stop building near the drainage sites.
Our call to the people is that houses that are near sewage ways and predicted areas, maybe before the flood, before the advent of the flood, they should clear their surroundings. Like what we are seeing in this place is an eyesore. So those people involved will be compel them to clear this place.
And at least 800,000 internally displaced persons are facing acute shortage of food, shelter, and Medicare in the recently liberated areas in the Northeast. That's according to the Director General of the National Emergency Management Agency, Mr. Sani Sidi, who's raised concern over the situation which he describes as overwhelming. He was speaking in Abuja after a road walk to mark the 2016 World Humanitarian Day. He explained further that most of those in urgent need of humanitarian assistance are children and pregnant women.